and character apply the church community, right? So we have more harmony. But sometimes we have some issue, the travel, something in the situation, unexpected something that matters in the church inside, and then we have to connect is out of the world, and non-Christian and then Christian have a warfare, and also there is some issue coming the inside church. We make some the relationship, we have to make more this setup, right? So today's the integrating prayer and the counseling skill. So we learn the Christian culture. So we have A group and the B group. So we had the blending, it's harmony, right? So integrate. So we had to see the human, the spiritual warfare, and then emotional, and then physical, and then the immune system, the movement, and then we have the behavior, the habit. So we include everything. So integrate. So we have two kind of a prayer: the healing, the prayer, and counseling prayer. Okay. So we have a step 1 to 7. We have to more the device here. The preparation, step 1, and then element. The step 2, the interview. The diagnosis, the first. The step 3, the invitation, the invocation. The step 4, the prayer over command or petition. The step 5, the line over the hand. The step 6, listening and the retesting. Listening and the retesting. And step 7, the closing and the gratitude. So we have step 7. So we can try to more detail. We have the testimonial and then evidence. The page is 74. The page 74. If you have the textbook, open the 74. The healing prayer and counseling prayer. The why both practice the healing prayer and the counseling prayer, the both together. They apply your the character or personality or issue or some the church's program. They often overlaps in pace, space, or the settings. They tend to have a different goal than metro and then vivis. They think over on emergency room for the soul and the others long-term physical therapy for the mind. So we have the mention of the physical therapy for mind. So mindfulness or counseling, the mind medicine, and the personal coaching include everything. So the babies, the methods, the goal, that we have an overlap. So integrate. So we not separate. So overlap this one. We have each single here. We are connect. We are connect, right? But we have it together. Here, the integrate, the overlapping here. This one, this one. So we have an overlapping here. So the healing prayer and then counseling prayer is overlapping here. The healing prayer and the counseling prayers, they serve a different purpose in healing process. So we have two. We have overlapping and then integrate, but each the prayer, the different purpose and the healing process. The healing prayer is often used for individually seeking to connect with God, the personal healing, and the spiritual growth. So healing prayer, the personal side. The personally is more growth, and then the spiritual power, and then the focus the individually, the seeking to connect with God, the personal healing, the spiritual growth. This the healing prayer can be powerful for emotional regulation. Yeah, powerful for emotional regulation. The grief and the process and the seeking empowerment. You have three. Emotional regulation, then grief, and the processing, and then seeking the empowerment. However, it is not the society or the professional counseling and should be used or alongside the psychological approach. So this side were the personal coaching side. It's not the professional, and other side were psychological approach. They're different. Okay, so the healing prayers in the personal side, in the personal coaching. The healing prayers, this is a typically focused on divine intervention and the immediate restoration of our holiness. It is often more the miracle oriented. So restoration of our holiness is not part. So we have the body, the whole nutrition, right? Whole the body, we have the natural body or whole medicine, holistic medicine, but this part, healing prayer, is a part. It is often more the miracle oriented. The primary goal, restoration. The primary goal is restoration. The intent is to see the specific element or physical, the emotional, or spiritual, the removed or healed by God. So directly the God healing the person, the hand. So Nazareth Jesus, the healing the people. So they won't touch and they sprout the word, the healing word. They directly the power and the healing power. So healing by God, the intent is to see specific element, the removed word, the healed by God. The power source, what kind of source, the root, and the more we have a good solution, the answer. The heavens emphasize the power of a Holy Spirit or divine entity at a more person. The heavens, they emphasize or power over the Holy Spirit or divine entities to act of the person. The setting, the often occurs the moment altar call or laying over hand or specific prayer in the meeting. The often occurs the moment altar call or laying on over hand and specific the prayer meetings. The participants role, the primary word is stative. The person usually receives the prayer from the leader or group. So the passive means we not active. Somebody give to me hand. So prayer. Some the church member or the prayer, some the pastor or minister, some the group leaders, they give more prayer for them. The passive receiver. So I'm teacher to your students. I give the prayer for the receiver, right? The passive. The active, maybe you pray for somebody. It's active, right? So there's a receiver. The temporal focus often look for the immediate or break thought, the change it about now. So present now. The no past or no future, the present now. So temporal focus often look for immediate or break thoughts, the change. It's about the now. The common use case, the physical illness was sudden trauma and were deliverance from the spiritual operation. The physical illness or the sudden trauma. So we have a trauma. I explained to you long time. We have post-trauma and second trauma and the future trauma, right? Or the expected occur or some sacrament or impediment, right? So the common use case, the physical illness was sudden trauma, the shock or something happened. Our deliverance from the spiritual operation. Okay, page 75. So healing prayers often less about the spiritual, literal, or more about the focus, the follow. In many situations, particularly those that lead toward ER, the skyward immediate word intervention, the process more. Come on. The follow especially leading. Okay. What's your name?
Muriel.
Yo, you come first time, right?
I'm I'm for the college.
College?
But
Where the
Brian
college?
said to sit in for now.
Transfer here. Okay.
Yeah.
That's me, you. So we have the integrating prayer or consent here. It's just this major.
Mhm.
So that your Christian spiritual warfare and the counseling.
Okay. Yeah.
So if you want a textbook, you don't have a, we have a now.
Not
You
now.
want the, ask the copy the content.
Yes,
Okay.
I will. Thank you.
The step one, preparation or element. Before you start, the goal is to get out of your own way. That means now, before you have your habit, you have lifespan, and you have some out of line and some your boundary area activity or some thought, your habit, the behavior, get out of your own way. Because before start, this is the program, okay? It's a prayer, the meeting. So we had to forget, maybe you are post the trauma, second is the physical issue, your something issue the before. Now, you are post. Post. The present, the future. So you have to stop here. Get out your mind or your behavior, and then also you have some trauma, the doubting, the depression, the emotional problem. Just stop here. Get out of the mind. Because if you want a distraction or you want a this setup and you want to revert, you have to stop. So empty. So whatever. This morning, right? This morning, what happened? Before 10 o'clock, it started 10 a.m., right? Class. So before, there was car crash or something happened or argue the family, husband, wife, or some car accident or something happened, so you program. Because you enter in my Lordland class, give some the set up your brain, you have to stop, right? You have to program. Empty, we fill up, right? But you fill up too much thought or something issue, the stress. I teach in 2 hours, never come inside here, right? So this means before you start, the goal is to get out of your own way. Your habit and behavior, your statement or something, relation issue, yes, some the trauma, everything, get out of your own way. This involves the shifting the focus from your ability to divine the soul. So you have to make some practice with divine. For example, your body, the whole body, maybe, what's your name? Marianne, you've broken your arm, right? So, uncomfortable, because you have given us the 1 month, right? Uncomfortable. So, this big issue, right? But you die or no? No, right? It's a piece of cake, right? Because we have a left hand, we are given us very uncomfortable. So very uncomfortable, right? So, but I can eat, right? You can eat food, right? You can eat shower, everything, right? Maybe we don't have the arm very hard, but we have one part. We have normal, right? It's uncomfortable. So we have the divine. So we have a lot of the issue on expected action or on expected issue every day, but it not cover all your body or span or the bite your lifespan, right? The visible part. So you have to control. You have the more divine the partly, okay? The divine source. The centers yourself. Take a moment of silence to acknowledge your divine fusion. The center of yourself, take a moment of silence to acknowledge and the divine presence. Ask for permission. Who approval? Ask for permission. Who? If praying for someone, yes, if we praying for someone, always ask, may I pray for you right now? And can I place on hand on your shoulder and consider the cradle shape agreement for healing? Okay, Madam, I want to pray for you, right? So can I pray for you now? So you have what kind of issue, what kind of problem? So you told me I understand your situation, right? And because you have some the car accident this morning, so I don't know that. So you want more injury was the trauma, so you wanted more paper of my body or some of the trauma, right? Car accident. But I don't know your situation. Just I want to say pray for you something. You don't know, right? It's not match, no power. So you have to give me some of the issue of prayer, and also I have to learn the situation, and then first I have to ask, right? Maybe it's a noodle. Maybe you don't want to pray, but I want to pray for by myself. 1A, no. It's a no match, right? So every time, if you have to feel out your heart. Oh, I want to pray for somebody because I'm a holy person. But sometimes, other side, the people they don't want to pray from me, right? So we have to more agree. So can I pray for your situation? That you say yes. Then how can I do? How can I for the prayer? So you have to please give me the information, and then I want more the channel A, B. You are channel A, I'm channel B. It's not matching, right? So channel A, I'm channel A. So we have the more the parliament or the prayer. So we have the more signal, same signal. But first ask the step. Okay. So ask for permission. If praying for someone else, always ask, may I pray for you right now? What kind of your problem? So what do you want? Your sick problem, or family issue, or finance problem, anything. So we have to know the issue, okay? And you have to keep the secret. Don't talk everybody, okay? So when you each by person private, right? The private area. The can I place hand on your shoulder? So we have the skinship or your head, or usually we have the button or the shoulder, right? So if you wanna touch the body, you have to ask permission. The concern, the credit saver, environmental healing. The step 2, the interview. The dynasty first. This leads into a question centers approach we discussed. You want to know what you are actually aiming. So you have to you want to know what you're actually aiming at. The question, what would you like God to for you today? What would you like God to do for you today? The goal differs. If they say, I have a headache, you might ask, is there any stress or specific event tried when he started? When this started headaches, especially the kid. So we have to question. So when I have more some headache because this morning I will oversleep, so I'm very hurting. I lost. So I will try to come early to school, but too much traffic and then some car accident, so we had a delay. Yeah, so I'm headache and nervous. Yeah, because Joey want to come on early, but traffic, so Dr. Choi is very angry, right? Right? So sometimes we don't know, right? So everybody have stress. Look, so we have to know that the question. Number 3, the invitation, the invocation. You raise feelings power down. You are inviting it in. You aren't calling power over down. You are inviting it in. The prayer, you simply invite the Holy Spirit. to be present. The prayer, simply invite the Holy Spirit or the divine to be present. Example, the happy with the example. Will comes your present here, come and bring your peace and healing power to name. So we welcome your friends here, come and bring your peace and healing power to Joy. So Maria, what's your name? Window. So we have the name, okay? So we have to pray for and give it the power, mind or prayer, and then last one you have to may add more name. Step 4, the prayer over command or petition. This is a more health, feelings prayer, different from the standard hopeful, no negative. So okay, maybe your situation much better, so your body condition is much better. So you have to give it a more standard hopeful prayer, okay? No negative. There are two main ways to approach this. Petition asking, God, please reach into this person's heart and heal the grief they are carrying. So God, please reach into this person's heart and heal the grief they are carrying. Okay, the petition asking the command. Authorities, based on the belief that the spiritual authority has been granted the believer, in the name of Jesus, I speak life to the dead lover, the pain you must leave this body. Note that this isn't yelling, it's calm, quiet confidence. So no yelling, it's a more powerful the voice. In the name of Jesus, divine, I speak life to death, loves, pain, you must leave this body. This isn't yelling, it's from the quiet confidence. Okay? So based on the belief that the spiritual authorities has been granted to the believer. So I want to mention about the believers more positive imaging. I have a lot of the patient every day. Very place. So some people sickness long time, the chronic disease. Some people have the IPO. So headache or stress. So I need too much people anxiety, right? The anxiety. Last week we learned the anxiety culture. So too much anxiety person, they want to more calm down and then they will relieve of stress or pain, right? So I want to try to more approach more the prayer and then treatment. Some patient negative person, they delay the treatment. But positive person more quickly removable or the pain or something issue and the more the peace of mind and the more healing, more improve the situation. So we have here, there's so many students here. Some people have negative mind and some people the positive mind, the different. So I know 2 hour class hour is not sure, it's a very long time. Some people live this around here, maybe 10-minute driving here. Some people from the 3 hour, 2 hour, they're driving from house, come here. I'm the 3 hour this morning. I wake up 5:30 a.m. I'm driving 3 hour, but fortunately today very short driving, no traffic. But usually the one students come 2 hour, maybe transport bus take time. So they want ambition, right? They more try to more work hard and then more because of more the listen to class. Why? Everybody want to improve by situation better than yesterday, right? Correct? So you have the 2 hour, maybe some kind of contents, maybe 1 minute, one contents, good for you apply your life strength, you change it, you have money, you make money today. You're lucky, right? Some people don't come in the show, the class. dear place or whatever. So you stay 2 hours. I teaching my evidence or my research and then textbook. Any kind of contents apply your lifespan. Maybe your whole person, your peace of mind, you're more happy, right? So I want everybody happy. Okay. The step 5, the laying on of a hand. If appropriate, the comparables, the physical touch, the traditional conduit or feeling prayer. So hand, because I want to give a hand the prayer, so maybe touch the shoulder or head. The where to place the hand, the usually on the shoulder, the head or specific area of pain. It is strict bound areas, monastery. Sometimes I pray for my patient, and sometimes I have the class in the church. I want to try to pray for somebody. I give the more shoulder here. Sometimes head. So the logics will ground the person, the make the spiritual moment, the physical reality. So the logics is ground the person and make the spiritual moment, the physical, the reality. The step 6. The step 6, 7, 6. Step 6, the listening and need testing. The listening and need testing. So if you want to pray for somebody, before we had more rule, right? So we have to notice what kind of the issue. So we have to let me know your problem. So we have the listening and the testing. So all the time the listening, no speech side. So first, and the other people want the talk, the listening, and then we the testing or question. The healing is the realist job, and it's over. It's open the process. The healing is a realist job, or it's over. It's open the process. Wait in silence. Wait in silence. After praying, the gift is a minute. Just in a minute after praying, 1 minute. We have higher time, 1 minute, because we pray for somebody. God watch the situation. We live together here. Now we are Christian here, right? We are Christian class, but we teaching and then you are learning. So God here, go together, this place. You understand? So if you wanna pray for somebody, maybe inside God or walk together here. Okay? The joy is sleepy, right? That's a movie, right? After praying, give it a minute, ask a person, what are you feeling right now? So is there any change or your peace of mind or your love is or so some angry or we have to know that to figure out the other people petition or the feeling. Very important here. I want to try to pray for person, but she's not happy. You have to stop, right? Because I want to try to pray, but I don't like to pray. We have to stop. Okay. So wait the silence after praying. Give it 1 minute. Ask a person, what are your feelings right now? Is there any change or your mood is okay? You're sad or you're happy? We have to ask. But we have to 1 minute. Yeah, skip. Right? But check-ins, if they say the pain and from 10 to 5, we have a pain level 1 to 10, 0 to 10. Now I have 10, but you pray for me now, so my pain relief for 5 or 4. So we have to change or the same or how's your feeling. We ask first. Don't stop. The pain and from 10 to 5. Don't stop. Pray again. for the limits, the 5. So 10 to 5, but 5, so we start more remaining. This is often called the persistent prayer. The persistent prayer. 한국말로 안수기도예요. The persistent prayer. So with more, feeling better, now my health is more better. The house your pain level is to 10 or 5 or 5. Okay, I more try. So please, I'm praying for the name of the Jesus. Please give the pain relief affairs. Get out some hair, the heat, the fever, was the pain. More try. Don't stop the prayer again for the remaining, the 5. This is often called persistent prayer. So usually the pastor invite the pastor to visit the hospital room and the home. So we give the prayer. So the patient, sick people, we more the try more strong power. So I pray for hand, but it's God healing the hand. Okay, this is the persistent prayer. The step 7, the closing is greatly. Neglect or another person feel 100% better or exactly the same. You cross your focus on love and peace. The neglect or another person feel 100% better or exactly the same. You cross your focus on love and peace. The goal, you want the person to live feeling, seeing, and love. Like our faith was experiment if a miracle didn't happen instantly. So everybody wants a miracle. So my patient, the take the Harvard medicine. So everybody have sickness. So maybe 5 years have sickness from the something issue, the disease. So I give a Harvard medicine. So maybe start maybe 5 days, 10 days, much better. And they had more transfer. Oh my God, I'm much feeling better than before. We had to transfer, but later the change because medicine is not cover all lifespan, right? We had the habit, sleeping habit, or dietary habit, or some the workness or situation, the too much overtime, too much no sleep. Every night we have to see the cell phone. Very unbalanced or lifespan, but then or medicine. So, why this medicine not the work? Why? It's a good medicine because we have to more change in my life, right? No change in my life pattern, so just depend on only the herbal medicine, it don't work. So we have to. You want the person to live feelings, seeing your love, like a faith experiment. If a miracle didn't happen instantly, so miracle. If you want a miracle, you have to change everything. So I told you, right? The prayer before we had to more get over my mind and then my behavior habit. So maybe you forgot everything from yesterday. You feel that you have new start. You're empty. So we have to fill up, right? So I have a copy here. I have a copy here. So I want a juice. I want a vegetable juice. So how can I do? Now I have the inside of the coffee, but I want a juice, green juice, vegetable juice. How can I do? Now I have a coffee inside here, but I want the apple juice. So how can I do, Joe? Joe, how can I do? I want the juice, but now inside the coffee. How can I do?
You change the coffee into juice.
Yeah, how can I change it?
You throw away the coffee.
Yeah, correct, right? So now we have to play over reset up our lifespan. How can I do? We have to poke out, right? We have to more to change it, right? It's empty. That's why you coming inside here. So I want to juice through away. Empty cup, and I have to washing, right? The little bit change the taste, no good, right? I want to change cup, or I have to change it inside the throw with coffee. So I'm putting the juice, right? The same thing here. So we have to set up our lifespan. The post-trauma or behavioral habit, we have to change everything. Empty. Today, then you start, right? The operatives or the failures, one of the hardest part or healing prayers, the when nothing is similarly happens, honestly, the practitioner the suggest. So sometimes the healing, maybe you have light, so we can see light, but dark over, we turn off the light, we do that with our light, right? The low light. So sometimes you can see, oh, really unchanged the ability. So really so we can figure out, oh yeah, it's a work. I'm going to change it. But sometimes I want to see something I can, right? The example. Sometimes we are outside all day outside here. I come here, inside here, the color dark, right? The same thing. You understand? So I want to see, you're bright. But sometimes we come in here, the inside here, the classroom is not bright the same. But later, maybe after maybe 5 minutes, 10 minutes after, it will be the return, your the ability to see, right? So here, one of the hardest part of healing prayers, when nothing similarly happen, authority or practitioner suggest, don't take the credit for healings and healings, and don't take a blame for the lack of workload. Okay, so yeah, sometimes we want more work, but sometimes I want 100%, but sometimes 70% or 50%. So don't blame, right? Don't blame. So don't take credit for the healings, and don't take the blame for the lack of growth. So we have to survive. We have to step by step. We have to continue. So don't blame. So I want 100, but it's a 50%, 70% lack of my separation. So we have to don't give up. We have to keep going. Okay. So your job is the input, the love and the failures. Output is a two higher power. So your job is the input, the prayer, but after the receiver, the prayer input, the receiver output, the more power, the higher power, the peace of mind, the more joy, or the solution of the issue. Okay. The counseling prayer. So we healing prayer we explain. So everything is okay. You understand the healing, the prayer, the personal issue, personal, and direct to the God. Okay, and then now with counseling prayer, explain what's different, and later after we explain the counseling prayer, after what kind of issues overlapping or integrate. Okay, now we have the divide, right? We have a divide here, integrate, but there is overlapping, right? So what kind of issue is overlapping? The healing prayer and then counseling prayer. The second counseling prayer, on the other hand, is our therapeutic tool. That the therapeutic healing prayer, the personal coaching, the prayer, the individually, the healing power, and counseling the power, the therapeutic. So just the, for example, the pastor, the pray for you, your lifespan, your situation, okay? And the healing power, only the pastor or minister or the church leader, the pray for you, your the situation. But counseling prayer, the pastor plus and psychologist or counselor or doctor together.
Okay, so therapeutic. You understand? Yeah, so the personal healing prayer, the healing prayer, just the human, the public, and the therapeutic, some pastor or team leader, the plus together, the specialist or doctor professional, the therapeutic. The therapeutic tool can support emotional processing, the defense work connection with God, and offer grounding someone toward vulnerability. So usually medical ministry. So many people have a group, the doctor group or special group. They more join the Korean culture, Korean the church community. We have every year one time we visit the Mexico or Tijuana or some area, Dominica. We send the medical missionary. So sometimes the Korean church have another missionary camp. So the pastor usually church member they going together, but they need more specialty, right? The specialty or more work, the voluntary. So many people the group, dental or the Chinese medicine, the acupuncture or some the counseling. The people more join the medical program. The counseling phase, on the other hand, is a topic tool and can support emotional processing that deepen the connection with God and offer grounding moment or vulnerabilities. It is used to more context or topic to help clients, the church member, navigate the conflict over their own mind and soul, the provide tool over emotional healing. So help clients navigate or conflicts over their own mind and the soul and their personality, and to provide tool over emotional healing. The counseling prayer, where the more focus is today. This is a more integrative process. We have to integrate process that use prayer tool within the border, the therapeutic or guidance based or conversation. The therapy border or therapeutic or the guidance or based conversation they within the use the tool is more growth oriented. So we have the foundation of our healing power, the personal healing power and the healing prayer, the foundation, and also here more growth oriented. So we have to integrate and we have some overlapping here. The pound over the house. So it's more growth oriented. The premier goal, inside, input, output, inside and then transformation. The intent is to gain the clarity, the process, emotion, and aligns also with the spiritual principle. The emotion and the aligns also with the spiritual principle. So we have this person, spiritual power is relative or political. So how much have the grip or the God or have the belief in the God? How much have a connection with the God? Is one first of all very important here. So we have a different way and different approach. The therapy or the healing, the prayer or content prayer. The most of all we have to check the spiritual power, the person. The power source emphasizes God presence thought or process of self-definition. Now say self-definition, the wisdom and cognitive shift. So three parts. So self-definition and wisdom, the cognitive. So we together the part over the part, the oriented, and this navigate and healing power, the foundation, and oriented is top here, the self-definition and wisdom and the cognitive shift. So we integrate the overlapping. The settings, the usually takes place in private, describing one or one section, the pastoral counseling or spiritual direction. So this is private. The healing power, healing prayer, I can pray for your people one time. And so name of Jesus, please my students more healthy and more the good parents were good and healthy, more please more hopefully the lifespan. Please touch them. Do one time we can touch your prayer for one time. For counseling the prayer one by one, the private, because the therapeutic mean it can healing power the prayer then cover all everything, right? So we need more accidental more therapy tool or treatment. So I can open the public. So each person individually have the problem in the issue, right? The private. So we have to keep the script and we have to one by one, each person. Okay, so different. The healing power and the healing prayer is a public together. In the church, okay, church, yeah, church the church service or and public areas so we can do. But counseling is a private. Okay, limit one person, declaring one person one session. The participant role, act or collaborate. So participant role is active and collaborate. The collaborate means we are separate, we have to work together to rate. The collaborate. The person take thought their issue. The using the prayer to listen for the still small voice or internal speech. So the public must speak more strong and powerful prayer, but one by one the private smooth and the voice volume down. The please maybe Mana's Joy please Joy is oversleep this morning. She's last time all night is movie. So she's tired. So please. So it's a more low voice, right? Low voice, and because internal peace. Maybe Joy, get up. It's strong mess is no, right? It's a counseling the prayer, the private, and then low volume because in the peace of mind. Okay, it's an internal peace. The temporal focus. The focus on the journey is about developing long-term coping, merchandising or spiritual maturity over time. The healing prayer, short-term and temporary, but his counseling prayer, the long-term coping, the merchandising, and the spiritual maturity over time. Okay, it's a lifespan, not a long time. Longest stay. But the healing power, there's some issue. Maybe there's some of person maybe sickness, some the cancer or something. So we have the long term we prepare every day thought. But suddenly this morning you are headache. Something is short term, right? The temporary. So this is the difference. The healing prayer and the counseling prayer. The common use case, the marriage is single. So relationship, husband, wife, the marriage life is something broken, something unbalanced, unharmony. So marriage is single, anxiety, the grief, the habit breaking, or navigating the complex now life decision. So we have to change the address because I am to more overstay or I am to more now. So I have the big house, but I have bankruptcy. I have to change the new small house. So we have the lifespan. We have the decision and grief for the anxiety, the trauma. So maybe struggle, finance issue, the common use case. The big difference, the healing power, healing prayer and counseling prayer was different. The the big difference is explained to you. If you have a broken leg, for example, there is a broken arm, healing prayer asks for the bone to keep it back together instantly. Counseling prayer asks for patient to endure the cast and wisdom to learn why you trip in the first place. So the big difference. If you have a broken leg, healing prayers ask for the bone to keep it back together instantly. But counseling prayers ask for patience to endure the cast and wisdom learn why you trip in the first place. Okay, you understand? So you have a good example, right? You broken the arm. No, you hit your husband, right? No, lucky. But healing prayer, the priest, the name of Jesus, priest, the bone, the capstone, right? The priest recovery fast. But counseling prayer, how can I do? It's a very uncomfortable, this one. So priest every day, priest more the bone is more cut, more recovery, and then she had depression. Priest she don't have depression, the peace of mind. There's something right, the difference in long term. So here, the prayer ask the counseling prayer ask for the patient to endure the cast and the wisdom to learn why you are trip in the first place. So when do you lead a prayer? Okay. Sometimes you pray for the God, right? So when you lead your prayer, you by yourself, when?
5 times every day.
Okay. How about you?
You don't need only prayer for asking, but you pray thanking God also.
You
can pray,
no listen. No
thank,
need, nothing. You pray for your God every day. Thankful.
yeah,
You're reading, are you open eye?
yeah. You
Right.
thank God for today. You're alive. You can breathe, and also for guidance, and for that day.
Okay.
And you can also pray thankful for the food that you're going to eat. And if ever you have like anything that you want to ask in prayer, you can do that. But what we're talking about is maybe the counseling prayer and the healing prayer. When you feel something's not right in your body, you pray your healing prayer because it's specific on what you feel.
Okay.
So that would be you're going to I pray whenever I feel something's not right.
Okay.
So but that's on my person. Now when you pray on another person, that's a different thing.
Yeah. So do you mind if you have your big issue, your health before you have the big issue, surgery or car accident, or you have an issue, the first time your lifestyle, you have or no? Your health or
The health issue, yeah. You have that too, so you pray for your health. Sometimes maybe a surgery before. Yeah.
That's right.
Yeah.
Because me too, I have experience. I almost medical the diagnostic. Almost 90% I cut my leg to both. So I can realize my situation because my previous doctor say you have to cut here tonight because you not cut tonight, maybe tomorrow, maybe you can die, right? So, but I'm not give up. And then why this is coming to my leg? The problem, why? What happened? I'm handsome. I'm very good person. Why? Why you give me this the second time? I'm never blame. But I want to try because even I treatment my patient. So I sick, but I healing the person, the people in my clinic. So why? But I want to try. I want to fix myself. No, I already. Maybe God takes my life. It's okay. Yeah. But I'm pray. Thanks God every day. Pray. So after some big issue, your lifespan, maybe your answer, right? Just I work, thank you. I can eat, thank you. And I can see, thank you. But for some people, they don't know. But we have some big issue is my lifespan, financial issue or some the health issue is more still we find out, right? Do you have experienced your big issue, health, your lifespan? Surgery or some other accident, anything? You have?
Not much. Maybe
Not much?
like a car accident sometimes.
Not big, that's small. I'm the roll over 3 times. I almost died. So how about you? You have a big issue, your health problem with your lifestyle?
No, just before coming USA, my body's whole body like very sick inside of my internal organ and all things. But after coming here, maybe California sunshine maybe heal me, or God give me healing power.
Okay.
So I myself healed all my. I am very healthy right now,
Okay.
and
Good.
then I could heal people.
Okay.
So that's why I am very interested this
The
chapter.
class. Okay.
Yeah. So
Okay.
I know this like a theory,
Okay.
but I did the healing prayer for the people, and they healed. For example, leukemia. On those days, I did not know what is leukemia,
Okay.
the word, vocabulary.
Okay.
But the lady come to me, I was healed leukemia. So another person is that's a professor healed. My personal opinion, just like when we over the prayer people, then the sickness we can divide like
The joy is
one
more
one
plus.
one is like we could pray by God, healed by God. Another sickness is not the prayer subject sickness. So we need like prudent to like here sometimes it gives broken bone, gives those things like we could pray for the like quick recover,
Yeah, recovery.
but that is not healing prayer subject, but my personal opinion.
Okay.
Yeah.
Yeah, thank you so much. Okay, so everybody have some issue. We have prepared myself, and somebody give the hand the visible position. But sometimes we have to pray the side. It's my position to pray for somebody. But sometimes your visible position with some the God or some the church member or some the people, right? So when do you lead a prayer? We can all pray all the time. So no listen. Sometimes very happy we don't need to pray. Sometimes we have some the screen time or some the sad time we pray for no. So all the time. The Roma 12:12, Colossians 4:2, there is 5:17 on community is for never stop praying. The three Bible the context the Romans, Goyrons, the Thessalonians, on immediately sought never stop the praying. Thus, plus the fact that Jesus craft parable encouraged to keep as its for example. See Luke 18 about the widow keep the petitioning or judge defined her. The cruel words in that sometimes our prayer don't at least instant answer. Okay, here. Luke 18, 누가 18 about the widow, the who kept petitioning or judges to define her. The cruel earth in that sometimes our prayers don't at least instantly answer. Okay. When do you need therapy? So before we had to when do you need a prayer and when do you need therapy? It's a more more grow oriented. As of these writings, I will work as a licensed psychologist for 16 years. I have treated clients with bona fide clinical disorders and also a subgroup that attempted to self-medicate, which then earns them the dual diagnosis because they had copy is not just the instant disorder, but also the addiction that developed afterward. Okay, we have give a sample. Some people, the behavior is not normal. If and I come to Sunday school, Sunday church, I drink alcohol, maybe I take alcohol in the morning, and I attended join the service, the church service. So you know that Dr. Choi is a drink this morning, so you or tequila or whatever, yeah, drink it. But one time, okay, but usually I'm not drink, but because under overnight drink, but not this morning. But you can feel, you can smell. Oh, maybe he have more alcohol, right? So maybe Choi drinking this morning and join the church service the one day. But I explained, no, last night, but it's not covered. My liver function not too much work, so still the smell. But every Sunday coming, but every Sunday same situation. So I'm dying. Every morning I had to drink alcohol. So coming to join the church service. So one time is okay. Excuse okay. But every Sunday, maybe 4 years, how can I do? It's okay. It's okay, or maybe alcohol addiction. I had to looking for some the specialism or counseling, or I had to go treatment, right? So first time okay. First time it's good. Maybe you can do something, right? But every year, 1 year, 2 years, the same problem. Every Sunday morning, my body, the smells alcohol. Yeah, Mariana too. Mariana or alcohol. Every week, every month, every year, is something problem, right? Not easy, right? So we need some the addition treatment, right? Yeah. So here, which then earned them the dual diagnosis because they had to copy in not just the irritable disorder, but also the addiction that developed afterward. So we had the counseling, the plus the therapy. So the pastor, you can give the prayer for the person, but you can try the prayer, maybe change your mind or something. It's okay. This is okay. But the alcohol addiction, you can't change it. right? We need some specialist, counselor, right? So when do you need therapy? You understand, right? The example. But that's not all. I've also seen the client who had no formal diagnosis at all. They sought my help for non-clinical matters, like wanting to feel more confidence or communicate more clearly. The having previously discovered IFS therapies, the some felt confident to learn more about their own internal world. The couple signed up to solve their marriage. My client, various background, convinced me that you don't need your extensive trauma history to make more appointment with a therapist. That everyone can benefit from seeing the mental health professional. So, yeah, so many issues. Now, the neighbor, my church member, some people have each family have some discrete issue. My son have an alcoholic, my son the trauma, mental problem. So I don't want to open mind, right? Even they want to bring to a counselor or the professional clinic, they don't want to open mind 100%. They want the hiding, the history, trauma is my mental problem. So because we want to change the situation, we have to open mind. But some patient or client, they want to hide it. So they don't want to open 100%. Okay, this situation. I want my clinic 10 years, the same. So we have the more good relationship, they open, try to more open the history. So my client's body of background confidence means that you don't need a extensive trauma history to make an appointment in a therapy. Everyone can benefit from seeing the mental health professional, but the police slide, the seeing a therapist to the top of your do list if any or following apply. So you have to more the cousin, so we have to looking for the therapist, the top of your list if any or following apply. So even the patient client they have to more list what kind of issue is my poster we have to change it. We have the solution, we have to fix. So we have to, even the patient have to make it some the list too. And the therapist, so we have to more learn about the client history, the background or some the trauma and some the history, life experience history. So we have trauma, I want to explain the trauma, the post-trauma and child trauma and result trauma means the second trauma. So maybe you have the our childhood trauma, the post-trauma, the maybe 40 years they have trauma. But now result trauma, present trauma, second trauma. Okay? So what's different, what's overlapping the trauma, I want to explain to you. The result trauma, the things over psychological trauma, as any advice the event that overframe our ability to respond. Example include experiencing the unexpected death of our loved one. Yeah, example include experiencing the unexpected death of our loved one. I have experienced my dad passed away 3 years ago, and unexpected because my dad we calling the before 3 days passed away. I'm Choi, I'm okay. My son, I'm okay. Maybe I recover a couple of days and they pass away. So unexpected the situation. So I'm the trauma. For almost 3 years, I'm still trauma because I'm not ready to send the God to my dad. It's an unexpected situation, right? So example include experience or unexpected death of a loved one. The losing the buildings in fire, maybe fire house. So unexpected, right? And the car crash 2 years ago. Every March, end of March, and my heart, my body memories injury in my car. Sometimes I will satisfied in some almost covered the 3 years, I roll over. I want to try the Saturday morning, very late day, so I want to be careful driving slowly. I want to come here, the kitchen, my car, I want to no speed, slow, but little some the plastic that sliding my car, no here and roll over 3 times. So suddenly, all the workers, my situation, I don't know that what's going on, and then my body I can move anything and roll over 3 times. Too much damage. So on inspector, some happen, so we give me the trauma, right? So how come we have the more solution to trauma? You see here. Ending the serious accident and witnessing or serving the violence. Yeah, witnessing or serving the violence. If a result insect or trauma to you, there will be sign earlier. Pay attention to your daily functioning into your sleep disprove or after accident or some issue, into your sleep the disprove or do you have a nightmare, little sleep, or outright insomnia, or do you wish to sleep away? So this kind, nightmare and overnight insomnia, or do you wish to sleep away? So maybe temporarily it's okay. We can try the more chamomile tea and then we add more banana, the honey. It's okay. The sleep aid, the melatonin. But over 3 months, 6 months, with continued same symptom and the situation, we need a counseling. We need more treatment, right? The how is your activity? It's my activity is okay, my diet is okay. I don't want to sleep, so I can eat all day. So how is your activity? Has eating been out of control? The eating disorder. This means that I want to skip the fasting or I want to overeating because there is some problem. The brain, the level problem. But I want to eating every day more. But I don't want the fit because I want to diet. So how is your appetite and has eating been out of the control? Now notice for end of our spectrum, whenever you have a consumer too much or not enough, whenever you have a consumer too much or not enough, the strategy, your mood as well. If you have a mood swing, loss of our motivation, mood swing or loss of our motivation, and listlessness, anxieties, or agitation, there is a strong reason to contact the mental health professional. Yeah, so swing more, mood swing, loss of our motivation, or listlessness, anxiety, or agitation, or there are strong reasons to contact mental health professional. So this kind of issue, this kind of situation, we will contact professional much better because we have a middle term, short term, middle term, long term. So 6 months, 3 months, we have to think about it. Okay, contact if we have some issue. The same goes the intellectual and recurring thought, as well as the flashback and then memories over traveled orders to your wisdom. So as well as flashback and then memories over traveled orders to your wisdom. For generation, many Christians have been conditioned to mental health screening spiritual battle. Yeah, spiritual battle. We test for names the Christian spiritual warfare and counseling, right? The poor generation, many Christians have a conditioner to mental health struggle as a fully spiritual battle. The spiritual battle, the spiritual warfare, the same mean. The best part, the kidneys. Best part on the kidneys. Anxiety is toward the cast or lack of trust in the God. Anxiety is why? Why anxiety occurs? Anxiety was cast and the leftover twist in the car. Depression was evidence of a weak faith. The different anxiety, the cast and leftover twist in the car. Depression was evidence of a weak faith. The topic, this is a topic that was for people who didn't believe enough. And so many suffered the silence. Convinced were seeking our professional help, would betray their devotion over to God. So it's not enough. The depression was evidence of faith. Topic that was for people who didn't believe in God. So too much anxiety, too much depression. You understand here? Why anxiety? Cast right? Cast over the God. Cast and lack over trust in the God. So anxiety. Depression was evidence of weak the faith. So many suffered in the silence, convinced were seeking professional help would betray their division the God. Okay. So Amadis argues that this mindset is just harmful, is deeply unbiblical. If you had a more lover on who was diagnosed with cancer, would you tell them to just pray about it? Or would you also help them find the best doctors, start researching treatment option, and learn what medical experience or mental health no different? So we had to more pray for some people, the cancer patient. If you had a more double on who was diagnosed with cancer, would you tell them to just pray about it? Is the overall is good? No. You would also have them find the best doctor and start researching treatment option and learn on medical experience or mental health no different. So I heard my mom 1 month ago. I'm very shocked because my sister, I have one sister, one brother. One sister is under 2 years. She's job is teaching person in the husband CPA. But my sister had the breast cancer. 6 months ago. So she didn't find out the quickly, it's a little late, but now the chemotherapy 6 times, okay. But everybody know that the secret, my sister would want to tell my mom, but my brother talked to my mom. Why? My mom's worried about the daughters because only we lose my dad 2 years ago. So my mom is overcome the mood. My mom don't want the depression. So the sister don't want to tell her. But even she don't want to tell me. But now they sometimes contact, but she don't want to tell me. Brother, I have the blood cancer. Don't tell me. Why? I'm worried about her. So here, just I'm praying for her. It's my job because I healing the person and then I have my own clinic. And all the time I'm the counseling dietary and the cancer patient or some people and help them. She don't want me my help. Sometimes I just pray. That's this situation. So my mom say, okay. My mom say just you say to pray for her. It's not enough because I'm not a public person. I'm a professional, right? So I have my knowledge and experience. I can give a hand. I know they have a doctor, good doctor, but I have my patient. Maybe I can give some dietary or naturopathy or nutrition counseling. But so if you had a loved one who was diagnosed with cancer, would you tell them to just pray about it? It's not enough, right? So if your family have your classmate or your church member has have cancer, suffer from the cancer or any kind of disease, just pray. Not you want plus you can try to give us them more information. Okay, so this one. The start researching treatment option and learn medical experience. Mental health is a little different. So more opportunity to more help the person, the player. The player manpower is good, but more plus. Okay, just the player no. We have more plus.
Can I say something
Yes.
about that? I think in my own understanding is
Okay.
that it has something to do with culture. Because because here in America,
Yeah.
American culture,
Okay.
when you say mental health, that's one of important thing in their
The body?
their lives.
Okay.
So they have that, like dental health, mental health is included with their health.
Yes.
But in third world countries, it is not so. It's not the same. In third world countries, mostly because some do not even have proper hospitals. Mental health is not an issue.
I see. I understand.
It's aside from a cultural thing also, people in first world countries, because they have, the facilities, they have the capacity for doctors of mental, and physicians, so they can offer that sort of thing.
Yes.
In third world countries, well, I'm not saying, I'm just doing a specific, mental health, you would say, just pray for it.
Okay.
You know?
I understand. It didn't matter the country, the America or Korea, Japan or the Philippines, it didn't matter. Because I want to focus here. For example, the conventional medicine, the medical field, they divide, right? The dental doctor, we have eye doctor, we have everything they divide, right? Yeah. But the natural medicine, the holistic medicine, the whole body. So I have cancer. I have cancer. But why the connected to mental? Well, sometimes some people have a lot of the medication. The basket, right? Maybe some people 10 or 12, the vitamin or supplement or prescription drug, everything. So maybe I have cancer, pain. So pain doctor give the pain pill in digest. So maybe they give the pill, and I'm headache. So maybe they give some of the medicine. So in the part, right? Body is the body, whole body. So whole body means we're. For example, I'm the study of mind medicine, the Harvard Medical School, and I study the life coaching, the psychology, and the natural medicine. So we see the whole body. So something I will maybe too much pee every morning, too much all day. So maybe the conventional medicine, they only check here, first check. But natural medicine, maybe you have too much anxiety, you too much stress, you going to too much the pee, restroom. So the mental, what's different to us? Sorry, why the mental and then cancer or some issue because the whole body. So conventional medicine and the best natural medicine, the holistic medicine. So the subject, the Christian word inside here. So conventional medicine only the part, individual part, right? But the Christian culture in the Christian world, the God created by body, the focus spiritual, mental, emotional, and the inner, the internal, right? And then movement, everything. So it doesn't matter country. The same thing,
Also, in America, their culture is like individualistic.
Yes.
They are like they don't want to do anything with their neighbors, so they keep to themselves.
Yes, yeah. The Korea is a more community together. Here, also Japan too, right? Japan too individually, and then American too individually, not together. The public,
That's why they cannot express.
Yes,
they cannot.
yes.
Now, when you go to the therapist, they let you talk. Talk.
Yeah.
Now, in the Philippines, everybody's talking and talking
Yeah, that's
and
right,
talking.
yeah,
So,
talking, Yeah, but Korea too. Korea talking, we work together, but now it is changing.
Oh.
Before, think about it. Long time ago, 1950, 60, 70, we have not much technology, material. We make a village, right? So we don't have a locked door. But now, everybody, the building, apartment, right? So everybody locked the private, right? So maybe sometime you change it,
Yeah.
room A, B, C, D, but sometime A is pass away by itself, right? We don't know that, right? But before long time ago, we know that maybe, oh, the Steve passed away, so we know that, right? But now, the Steve live A apartment and B, just the my door, the doors, right? But we don't know, so the culture different. Maybe later, after 10 years, more. So the culture, the different. Yeah, sometimes, yeah, you are correct. The culture is different, right? But basically, it's the conventional medicine and the natural medicine different. Natural medicine, the whole body. They check the spirit and the mental, and the emotion and the physical issue, everything. But conventional, only the part.
Okay.
Yeah, so the Christian culture is Christian because we know, right? The who made the body, the God, right? God created everything. So God know that my spiritual power and the mental problem, the issue, everything, all right? Yeah, so that's right. So your opinion, I upset, but we focus the class, the Christian culture, and then the whole body, okay? The ideas, the path to more happier somehow, with the others, the path of dystrophy, in reality they have a complementary role. The complementary role is integrated the same relative. Two sides of the same coin. Yeah, two sides of the same coin. One coin, we have a front, the back, right? Yeah, so we have the healing power, healing prayer, the constant prayer, in the back or front, one coin. The prayer connects believers to God. For therapy, we keep them either more tool, navigate or accomplish over their own mind. So with the one plus, we have the one coin in the back of front, but we had a treatment or some the therapy is a little more air. So tool navigate or complete over their own mind. Not simple, it's a complete. So we have an integrate, overlapping. The question central prayer, the technique. The question central prayers, open call, inquiry, based prayer, or listening the prayer, the shift, the focus from the monologue, where you tell God what you need. So where you tell God what you need to dialogue, where you ask target question and wait for internal approach, the scripture was shifted in your perspective. The thing over is moving from glorious list, the style over praying to consolation, the style. So we have Christian centered prayer technique. The core philosophy, instead of trying to convince divine, you need to change your circumstance. You are asking for the insight to see those circumstances from the different vantage point. It's a built on the ideas that the small voice is often waiting for invitation to speak. So the still small voice in the open to quiet time. So we have taken the prayer for somebody, we have to 1 minute, the waiting, right? We have to response. Well, how's your prayer? The prayer will little change it. So the still small voice and open waiting for the invitation will speak. Keep technique or approach. The immunal approach presents a base. This focus on the perceivable connection. Instead of asking for the stuff, you are asked, God, where are you in this room right now? God, where are you? I need some of the prayer. I want to more serve my situation now. I have the screen time. Where are you in this room right now? Or what do you want me to know about your present this memory? What do you want? What do you want me know about God? Please explain to me what you want from me. So why I have this issue, situation, by screen time? Why explain to me what you want? That you are present in the memory. So we have to more list the God, the question, and in the center of your mind. What do you want me to know about your present in this memory? So who asked the God? Yeah, so please, God, give me answer. So what do you want me to know about your present in this memory? The root cause inquiry purpose inner healing used when feelings or triggers emotion. Trigger emotion, the trigger means we have the first time something you continue present. The trigger, like a sudden anger or shame, you ask, why am I feeling this level or intense than now? What is the lie I am believing about myself in this moment? The two top, the why am I feeling this level of intense than now? Or what is the lie I am believing about myself in this moment? The evaluation exam review based a structured techniques over looking back at your day is the two central questions. When I feel the most alive or connected today, the consideration to when did I feel the most drained or distraction. So we have two questions. The identity question, a powerful tool for self-worth, you ask value, you ask what do you say that I am? This means bypass your own inner critic and listen for hiders the perspective on your value. Yeah, this means the bypass your own inner critic, listen for hiders perspective on your value. The three ways inquiry, when stuck between the two choices A or B, you ask, is there the twist way I'm not seeing? This invites creative problem, the solving into a spiritual space. So we have a question and the who, the God. So here, the key technique in the approach. So we have to more the register God, the skills. How can I do now? I can by myself, I will control. So I need your help. The God give me the direction, the guideline. Yeah, this means the how to practice step by step. So we integrating prayer, counseling skill. So we have the how to practice it step by step. So please no rush. One, settle the street. Take 2 minutes over silence to dial down your own internal chatter. So first of all, you want a prayer time. No less we have to organize your sacrament environment. You clean your desk with down in the middle of the Bible and the memo and the water. So settle the street. Take 2 minutes over silence to dial down your internal chatter and then peace of mind to calm down. To the single question, turn paper, the universe is a 20 question. Turn the paper, the universe is a 20 question. Pick on the specific, open and the question. What is the one thing I need to focus on today? So we have a 20 kind of list. So first of all, I had to change my situation and anxiety mood or stress mood. So we have number one, we pick up only one. Don't multi option. Don't take the option, the server, only one. What is the one things I needed to focus on today? Third, activating. This is the hard part. You aren't thinking of an answer, you are listening for thoughts that doesn't feel like your own. Often thoughts that is kinder, more creative, more convincing than your usual mental loop. Yeah, so we have the active waiting. Number 4, the wide and the test method, just down whatever come to mind, no matter how well that is. Evaluate it is a loving, or it's a right, you are done, duty is a sign, is a core value. So we have a, there is the elevate is a loving, or right, or the value. So we have to more focus on more optimal, optimal the issue, and then we have to pick up, and then also you have the matter, the solution. Or practice, if you find yourself getting answers that sound exactly like your own answers in your practice, your failures is negative. That is usually just your goal, ego thinking. In these techniques, the divine the response were potentially catered by peace even when it's challenging you. So very important here. The healing prayers. So we summary now. Healing prayer, the emergency room of faith. Yeah, emergency room. Yeah, somebody now emergency room. The healing prayers typically divided into two categories: the physical healing, mending the body; inner healing, mending the soul. Okay, the physical healing, mending the body; the inner healing, the soul, the spirit. The command models often seen the physical healing. This is a assertive. Rather than your policy request in the command, the condition to review based on spiritual authority. The pain, go in the name of Jesus, please pain leave with we have the infection, the body, please go away, so please the control of the pain. The inner healing models, the third word TPM, this focus for emotional trauma. The techniques, the facilitating the happier restore painful memory and identity, like your believer in that moment. I am always alone. So your sickness or isolate or loneliness. So I always alone. So you have to believe practice to help you restore painful memory and identity. The goal, you then ask God to replace that, right? True. It's like a spiritual surgery. Find the suffering, pull it out, and then let the wooden cross. Okay? The deliverance aspect, the sometimes healing prayer involve clearing the air of what practitioner call spiritual operation or stronghold, the removing external the spirit interference that the block the holiness. You're cleaning the air, the mood too. The what practitioner called the spiritual operation or stronghold, removing external spiritual interference that block holiness. The counseling prayer, the long term, the physical therapy. The emergency room is a healing prayer. The counseling prayer, the long term, the physical therapy. This isn't about on time, the miracle. It's about the sustain the partnership. It ranges from the clinical therapy to spiritual mentorship. The clinical Christian counseling. I have the books, the Christian oriented counseling, the book. So here, clinical Christian counseling, their licensed therapists, APC or LCSWs, who use standard psychology like CBT, but incorporate faith to help positive feeling. Here, incorporate faith to help positive feeling. Example, using word chair exercise, the way you imagine the sitting in the room as you voice your anger, you calm down, and then some you have the reflection, the meditation, or some the plan down, the mind control. The Bible counseling, this lens heavily is the spiritual, the dynasty manual, is focused on eliminating behavior towards the biblical principle. The eliminating the behavior and the thought, the base, the Bible, the principle, often using prayer for compassion or element. The spiritual direction, unlike in traditional counseling, which is solve a problem, the spiritual direction help your Lord, God movement. So God movements, the spiritual direction help your notice or godly movements. The Bible is the holy companion listen to your life story and ask, where was God in the modern Thursday morning? It's about craving audience rather than the fixing symptom. So we have to know that, I told you, right? The prayer, the before, we have to know that the situation, and then we have the history. So where was God in the moderns? The Thursday morning is about craving audience rather than the fixing symptom. The third question centered prayer, the consolation, question center prayer. Yeah, this is the specific techniques often used inside order 2. It's based on the thoracic method. The idea that's the best way to find the truth to ask the right question. So we concentration with the healer and then prayer. We have to know the information from the other people. So we have to submit the consultation, the prayer for chart or something, right? So the idea that best way to find to ask the right question. The immunal approach, starting with joy. Instead of starting your pain, you are starting asking, God, show me memory where I feel safe or joyful. That the connection is online, so you then bring the different problem into that, the space of safety. So Emmanuel the approach, so online, you then bring the different problem into that space of safety. The root cause inquiry, when you feel sudden surge over anxiety, you don't just pray for go away, or you ask. So you want the anxiety temporary problem, you want to go away, or you want to control your treatment. The what am I actually afraid of right now? So when did I first feel this way or child? The post-trauma, then Jesus, what is your perspective on this fear? Jesus, why I am feeling this way? The fear and some fear. What is your perspective on this fear? The Lordland is man daily review. At the end of days, after the end of day, every day you ask, where did I recite love today? Where did I recite love today? And where did I embrace it? It changes your own life, test the study, and then question. So every day you have to write down your diary and about today, that's for issue today. You have to regarding the issue of I'm the yelling somebody, I'm not give some the give the heart, break heart, or thanks for the list. Every day you have to check.
Like
Right.
a daily journal.
Yes, daily journal. So 10 minutes. I'm every morning. I say just thanks for God. I open eye, and then afternoon before bedtime, thanks for I write down. It's not easy. Maybe 3 days I will plan after program and skip. But you have to try to keep going. Yeah, piece of cake, more make the volume, right? So try. So here you have to know the healing prayer, the constant prayer, question send with a remote device, the face agent task, healing power, and counseling prayer visual the state, question send the reflective or creation, keepers be healed, destroyed. Let's work toward this. The counseling, the question, what do you see here? Yeah, so more growing the spiritual power, right? And main tools, anointing the pace, wisdom nutrition, the silence inquiry, question center, and better the surgeon, the coach, director. I told you, right? The surgeon and healing prayer, emergency room, the counseling prayer is a coach, and question centers or the detective, and then healing prayer, counseling prayer, the mix approaching, and then integrate the overlapping. So the intersection, you might start with question center prayer to figure out why you are stuck in the move into counseling prayer, so first trauma, and the healing prayer to close the spiritual wound. So today we learned just kind of step to 7. The main focus is healing prayer and the counseling prayer skill. So you can try apply to your church community or your family, even you are by yourself, your husband, wife, and the family member. So you have to respect your other people. It doesn't matter the sex or age, they're different. Others or child, but you have to respect them. So before your prayer for you have to open the mind, okay? And you try to go to the